The Virginia Garcia Memorial Health Center is most well-known in Newburgh and Yamhill County as the go-to health center for migrant and seasonal farm workers. But today, we're going to take a deeper look into this organization. In this episode, Executive Director Stefanny Caballero will share the tragic story of Virginia Garcia, a 6-year-old who lost her life because of a preventable infection in her foot. We're also going to learn about how the foundation got started, who it serves, and the critical role it plays in our community. Stefanny will also share about an upcoming expansion that will allow the health center to provide even more much-needed care to our most vulnerable populations. Hi, I'm Daniel Roberts, host of the Giving Town podcast, where we share stories of hope and generosity in Newburgh and the surrounding areas. We live in an amazing community full of incredible people who are working to make Newburgh an even better place to live. And this podcast is all about sharing those stories and helping the people in our town to be inspired, get involved, and have hope for our future. This podcast is also brought to you by my real estate team, the Joyful Roberts Group with Premier Property Group, LLC. And it's also a part of our mission to serve this community, not only by providing amazing service to our clients who are looking to buy and sell homes, but also to help Newburgh be an even better place to live. So if you're looking to buy or sell a home anywhere around Newburgh, reach out to us. We'd be happy to serve you and take great care of you. Well, thanks for tuning in, and I hope you enjoy this episode with Stefanny Caballero. Stefanny, thanks so much for being here today and joining me on the Giving Town podcast. It's a pleasure to have you here and learn more about the Virginia Garcia Memorial Foundation and the Health Center.
Thank you so much for having us here, Daniel. Pleasure.
So a lot of people in Newburgh know about Virginia Garcia, and they know it as a health center, and a lot of people don't know anything more than that. But there's actually a pretty special story behind Virginia Garcia, who she was, and how that all led to what Virginia Garcia is now. So can you share about her story and what that situation was and how it led to the creation of the Memorial Foundation and the Health Center?
Absolutely. It is actually one of the most inspiring stories that most of us as employees get to share, and not just with each other, but with our community as well. Virginia Garcia was a little girl, 6-year-old little girl that was traveling with her migrant seasonal farm working family in 1975, as they did every summer. They made the trek from Mission, Texas through California to Oregon. Their final destination was Cornelius. In the summer of 75, on the way here, Virginia got a cut in her foot, and by the time they got to Cornelius, it had become severely infected. Stories go that vary a little bit, but they go that either Virginia wasn't able to get the care that she needed, or that she did but wasn't culturally appropriate, and she unfortunately ended up passing at her housing complex while her parents were working the field. Wow. And at the time, there was a lot of activism in the Cornelius community and surrounding communities to secure resources for the Latinx community, for the farm workers, and ensure that they had access to services and, again, resources and tools that other community members could access. And so when Virginia passed, these activists, these community leaders, truly rallied around her death to ensure that it never happened again. And within about 2 weeks after her passing, they opened the first Virginia Garcia Memorial Health Center in a 3-car garage in Cornelius. And as they say, the rest is history.
Wow. I have a 5-year-old son and a 3-year-old daughter, and it's hard to imagine the grief of thinking something's just a cut and that'll heal and they're fine. And then, to have that happen, the death of a child is, I know people who have lost children, and the grief, you don't know it unless you've experienced it. So I can only imagine the hardship for them. But also, like you said, it's a very touching story that the community rallied around that family. And within 2 weeks was already providing care. So that's amazing.
Yeah, we open as a full volunteer-run organization within those 2 weeks, and again, stories. We're actually working on a history project for our 50th anniversary next year, so we're collecting all those stories. But the founders shared that these activists, these are founders, these community leaders, got in a van and drove and to the Sisters of Providence, and that's how we secured the seed funding to open in that 3-car garage. And by the end of the 4th year in operation, we were a fully run organization, and we actually were operating across from that 3-car garage in the lot across from the street. And that is where our flagship site, our Cornelius Wellness Center, is now located. So we've been in this community for nearly 50 years, serving a population that continues to be underserved, and really filling a void in the community. And nowadays, Virginia Garcia operates 18 clinic locations. We serve more than 52,000 patients, and also have 2, soon to be 2 mobile clinics that take services right where the community lives, works, and gathers.
Wow. And when did you come to Newburgh?
We opened the Newburgh site in 2014. And it's our clinic, I should say. And the clinics is in a small office building. And when we opened in 2014, we rented 2 separate suites and on complete opposite ends of the building, actually. And the county and WIC operated the other suites. And it's continues to be a small operation. By now, we serve about 3,000 patients between our primary care site and the dental suites.
And that's on an annual basis?
On an annual basis,
okay.
Correct. And we are working currently to expand that, and I look forward to sharing a little bit more on that. But yes, we've been operating for 10 years almost.
Wow. Now, you mentioned a little bit about, the rest is history, but for those who don't know the history, so you've expanded a lot since then. But what does Virginia Garcia, as a healthcare organization, what do they do?
Yeah, that's an excellent question. So we began our services in 1975, and of course, like any organization, experienced a lot of change, a lot of growth along the way. A lot of expansions, not just physical locations, but also in the integration and the wide array of services that we provide. We are a primary care site, clinic, and as we continued on this journey of better serving our community and particularly providing what we call whole person care, we've expanded primary care site to also include dental, on-site pharmacy. We provide outreach services, wellness and education, and mental and behavioral health services. In addition to that, our clinics and our locations offer eligibility services. So we have community health workers, navigation services, and they work with community members to complete their applications for the Oregon Health Plan, resources that they need to focus on their well-being and address social health-related needs, which are basic needs that impact their well-being. So yes, over the course of all these past almost 49 years, we've grown to better serve our populations, to become a reliable one-stop source, if you will, for that primary care and expanded services. And I love to share that in these 18 sites include 6 primary care clinics. We also operate 6 dental clinics, 5 school-based health centers. So we are located in the schools where our our young patients go every day. And then we have a reproductive health clinic in Hillsborough in addition to those. And we have those 2 mobile clinics. So we're going out and not just serving the community in our brick and mortars, but also taking the care to where they are.
Yeah, and you mentioned that it's filling a gap that wasn't there. So when you talk about the clinics and who you're serving, you mentioned migrant workers, but it's more than just migrant work. Like that's kind of the focus. But can you share a little bit about your population? And actually, one of the questions I was going to ask is you use the term culturally appropriate, and there's also the term culturally relevant. So why is that so important when you're serving this community? So I guess it's kind of 2 questions. What does that term mean? But also, who is the community that you're serving? And I guess what's the gap that you're filling that they couldn't get by going to one of the other primary care providers?
Yeah, that's an excellent question. So I'll answer it in a few parts. First of all, many community members, when they see our name, Virginia Garcia, the first question or the first thought that comes to mind is we only serve Latinx patients. The name Virginia Garcia was chosen as a way to honor and continue to live the legacy of little 6-year-old Virginia. It really wasn't a way to position ourselves as we only serve this population. It is to truly lift up her name and her legacy every day in what we do. So that's where the name comes from. In terms of our patient population, we do have a strong emphasis on migrant and seasonal farm workers. And here's why. Virginia Garcia is a federally qualified health center. And as such, we have a designated service area that we work within. And that is Washington and Yamhill counties here in Oregon. And as part of that, we also have this special designation, and we are the federally qualified health center serving that population in these 2 counties. So as part of that, we have that strong emphasis in serving, have had all along, and continued serving that demographic.
Can you share about what that means? So you're a federally qualified what was the word?
Health center.
Health center. So that, and you're the only one, you said?
No, there's more in the state.
But I mean the one for Yamhill and Washington counties?
We're the one that's designated as the health centers, community health center, serving the migrant and seasonal farm worker population in the 2 counties.
Okay, so what does that look like, and what does that designation allow you to do?
Yeah, so what that does is, first of all, the area designation means that we operate in the 2 county area. During COVID, we used to get a lot of inquiries around going to do vaccination events in Multnomah County, and Multnomah County has a federally qualified health center. So we have to really keep our resources and support in this area. That's how the federal government sees our operations and how we enter into this agreement with them and what we'll do. The migrant and seasonal farm worker designation means that we have a strong, like I said, emphasis in supporting that population. So it means that when we have, for example, wait lists for our services, if anybody is a farm worker or has been within a certain number of years or is an agricultural worker, they automatically are one of our priority populations. Okay. And so it doesn't mean that, we stop seeing other people. It just means that it helps us prioritize their care as they come into our wait list and trying to get established with us. It also means that we really work to ensure that our care is appropriate for them and meets them where they are. And I know your question about the culturally relevant and cultural appropriateness ties into that. Mm-hmm. But for example...
well, we can get... Yeah. Actually, I had kind of another follow-up question.
Go ahead.
I'll get back to the culturally appropriate part because it's an interesting... dynamic you're facing being the federally qualified health center for Yamhill, Washington counties, and specifically here in Newburgh as well, obviously, because we're in Yamhill County. which one I'm just thinking that probably creates an interesting seasonal dynamic for you, because the winter, when there's not when farming's not happening as much, it changes the demand in a way, I'm sure.
It does a little bit, but we're also getting better at looking at the gaps. There's a lot of plant nurseries in the area and, a lot of wineries as well. And we have a strong partnership with other organizations that are serving populations. So Salud is usually one. I think you're the one that asked me when we met what the connection was. So or somebody did at the meeting where you and I met. Yeah. But we have strong partnerships to be able to deliver care. So as part of that, and as a result of COVID, we've realized that some of the nurseries, for example, do experience the workers' challenges with accessing healthcare. Many of them sometimes provide insurance, and they have the capacity to go seek the care and have the coverage. But as many of us have seen, access is very limited, particularly in the rural areas. You may have insurance, but you're still not able to get a provider. And so really ensuring that we're able to think about where those gaps are, how we can better serve that population. And in the summers, that's what the main role of one of our mobile health clinics is. We go to the housing complexes where the migrant and seasonal farm workers come, also some of those plant nurseries, and we bring the care right there. And we have partnerships so that at the housing complexes, we're seeing them after they get home from the harvest. And we have gotten really smart about the way in which we provide the wraparound services. So we also partner with other organizations to bring other resources to them. It might be organizations that provide legal advice on wage and, there's a lot of changes that they don't know about on wages and how that impacts if they work in Cornelia's, but then they come and also pick and wash it in Yamhill County. So we seek to really provide a lot of those resources. We partner with the food bank because one of the most ironic situations is that those that pick our food and put fresh food on our tables most of the time lack the resources to have enough food for themselves. So we do partner with other organizations to be able to bring their resources on site. And with the nurseries, we have worked with them to also come during the work day. And, we set up shop and we see workers during their work day, and is a lot more feasible for the nurseries to let their workers come in for 15 minutes, get checked. We do triage, further checking, than to lose that worker for the full day, right?
Yeah.
And they're ensuring that they're getting the access that they need and removing barriers to care, which is truly at the heart of who Virginia Garcia is in our mission.
And that was one of my next questions with there's kind of 5 areas from what I could find on the website, about like 5 areas of focus: advocacy, outreach, innovation, patient-centered care. And I, on my question, had outreach twice. So I think I missed the one. Wellness. Okay. I was like, it's not outreach twice, that's for sure. So you've got these different areas of focus. And I'm thinking, I actually used to work in a cherry orchard when I was in high school and parts of through college, because where I am from in the Dalles, there's a very strong migrant population there. Yeah. I know many of the workers would come. Their minds are often not on healthcare. It's just, I want to provide for my family. So I imagine there's a lot of, and maybe that's what this advocacy is, that advocacy and education of expressing the importance. For example, Virginia Garcia's family, when she came, it was a matter of, they didn't realize how extensive it was, and otherwise they would have tried to get some kind of care. But many times there's just not that awareness, maybe, or we're kind of used to people thinking a certain way, but not all people in all cultures obviously think the way that we do. So that's I'm sure we'll get to that with the culturally relevant or culturally appropriate care, how that might look a little different than what most people are used to. So when people come to these mobile clinics, at whether it's at the nursery or wherever it might be, is this if they're sick, or is it like just a check-in, like to say like, hey, just like preventative care? What does that kind of care look like?
Yeah. So when we go to provide care on site, whether it's at a nursery or the housing where they live, actually we have events to visit low-income housing as well, in the more urbanized areas. And any and every time that we're going to engage in that, we have a strong focus on outreach. We want to make sure that whoever our target is, they know we're coming. They have a good idea of what kind of services they can receive from us. And we also come prepared, again, to remove barriers. At the end of the day, our mission is to provide high quality, culturally appropriate care to the communities of Washington and Yamhill counties, with a special emphasis on seasonal and migrant farm workers. So our goal is always to remove those barriers. So when we come prepared, there's a lot of preparation that goes in that. And so right now we're actually in the process of preparing for our summer program, which will launch at the end of May or late June and run for the summer months. And part of that includes reserving some slots at our brick and mortar clinics, particularly Cornelia's Wellness Center, some Newburgh as well, but we reserve some slots so that when we go on site, there are certain services we provide, some health screenings, some triage, but as you can imagine, we're not able to do a full-on exam, particularly because of the volume. We sometimes go and there's 100 employees, 100 workers that we have to see, and we do try to see everybody. So many times if they need more care or stronger follow-up, we set up shop and we have registration tables there that will work with that individual to schedule them at one of those sites, because we've already reserved some spots. If they have transportation barriers, we provide transportation. If they need an interpreter, we'll schedule that, or make sure, again, traditionally some of the sites that we're reserving slots for them have bilingual, bicultural staff. So yeah, it's a whole process, and it's what really helps us be successful. It's also how we partner with Salud, for example, when they go and provide services on site at vineyards. They do on-site care, and then Virginia Garcia does the ongoing care. So they get referred to our clinic, and then we become that primary care provider. So it's a strong partnership to ensure that the workers have the resources and the care that they need. And as part of that planning, and I said, we have a strong process already. We've been doing this for more than 40 years. We have an outreach team, and our outreach team play a key role in ensuring that the workers know we're coming, that those nursery partners know exactly the window of time that we'll be there, that we schedule them if possible. They also run on-site education programs where we talk about safety, protecting themselves from heat. We talk about, you mentioned sometimes they may not know how to manage certain conditions or when is a good time to check. So all of our on-site programs, as some are registering, you'll see Roberto, one of our outreach employees, doing presentations with a small group talking about, remember to hydrate, remember to take your breaks, this is what you're allowed to do, talking about chronic disease management. So there's a lot of coordination that goes around coming in and delivering this care so that we make the most of our time with them. Yeah.
So that was one part too, and I realized I kind of jumped around with the 5 areas of focus. So you explained the outreach side. Can you explain the other ones as well?
Yeah. So I'll go a little bit in order that you asked me about. So advocacy, it relates to what you were saying a little bit, but in our mind, truly the advocacy work comes from this responsibility that we have to our patients in ensuring that we are providing not just a safe environment, but we are championing and really speaking to their needs. And this may be when it comes to some protections, for example. We talk about serving migrant and seasonal farm workers. We've had some of the hottest summers here. So we talk a little bit about what does that mean for our extremely vulnerable patients who are day in and day out working in that extreme heat. It's also about policies that impact the care that they have, that impact their well-being. So we may engage in some legislature around culturally specific language and access to that, or indigenous languages and accessibility to that, or pieces around workforce development that impact our ability to better serve those patients. So advocacy is definitely more around speaking to the needs of our patients, speaking to the needs that we see as healthcare as healthcare professionals in ensuring that the process of healthcare delivery is adequate and, again, appropriate for the populations that we're seeing. Outreach, I mentioned a little bit, it's truly at the heart of who we are. I mean, we began in hopes to make sure that any and every farm worker had access to the care that they needed. So it's become a true, a close pillar, as you call them, to the work that we do. And our outreach team is essential to that. Meeting community members where they are, not just with the clinics, but taking those educational opportunities, tabling to ensure that our community knows who we are in the programs that we're providing, the services that they can access through us. Also making sure that they know about the resources that we can make available within and outside of our walls, and how we do that. A little bit about outreach and advocacy combination is, during the pandemic, there was this effort to protect farm workers. And so we had the funds that were able to distribute for farm workers that had COVID, but they don't have leave. And so by working with the group, all the organizers in the coalition, we were able to connect some of the farm workers that needed to be on quarantine to this funding to be able to subsidize their income because they couldn't work. Yeah. So it's a combination of those two, and how we advocated for those needs, but also how the outreach team was very efficient in understanding, okay, do you have COVID, and how they work with those patients. Wellness, truly is about ensuring that we're providing the resources, the education, and the tools that our patients need to live healthier lives. I'll hit a little bit more when we talk about our Newburgh Wellness Center, but with 2 wellness centers under our current sites, we're able to provide on-site exercising classes, cooking, nutrition classes, all of that in culturally specific ways, so that when we're talking to patients around managing their chronic disease, diabetes, we're talking to them about how to prepare foods that are specific to their cultures in ways that isn't telling them you can't eat this because that's their culture. We have to be more thoughtful and say, here's how you manage your portions. Here's how you can mix certain foods to make it more manageable for your condition. So that's what we mean by wellness, is this focus on how do we provide the tools for them to be able to care for their overall well-being on a daily basis, instead of just saying, here, you have to eat healthier, go figure out how. Innovation is the other one that you mentioned. And, we, as a 600-person organization in the 2-county area, 18 sites, we are still a very nimble organization, and allows us to respond quickly to the needs of the patients, but also to better ways of doing things. And one example that I like sharing is transitions of care. We had this team in Beaverton embedded in that site to be able to manage the emergency department utilization. And we have other partnerships as well. Right now, we have a strong partnership with Washington County to serve the houseless population. And we come on site to a 10-bed shelter and provide care. So innovation is something that's very important. And helps us be more effective. 2 years ago, we actually revamped our workforce development programs in very innovative ways, where we take and invite staff at the already existing staff from our different sites to apply if they want to pursue or continue their careers in healthcare, to become medical assistants and dental assistants, because we know there's a shortage of that. So what better way than to promote from within and support them in their education, on their training, without losing any income. And at the end of the day, they come out being able to earn higher wages and provide for their family. So a lot of that is what we like to think about when we think of how innovative are we as a health center and as an organization. And patient-centered, everything we do here truly has the patients at the heart of our focus. What is going to be better for the patient from a service delivery standpoint, from an access point, quality of care. So all aspects of what we do have those that we're serving front and center.
Well, thanks for sharing about that. And one of my questions was going to be just on a practical level, what it looked like for people needing care. And I think you explained that pretty well, unless you feel like there's other aspects to share about that.
I'll hit it quickly. For us, being successful at that really looks like a welcoming, I like to, just kind of describe inclusive, diverse, accessible, truly vibrant medical home where they meaning our patients, can come and feel like they can trust the organization, where they're going to be treated with dignity and respect, where they're going to receive the care that they need and deserve, regardless of income, race, social, economic status, country of origin, language. They can trust Virginia Garcia to be the place where they're going to get the care that they need, where we take into account their cultural backgrounds, the norms, and the experiences that brings with it. Newburgh is very different than our Beaverton Wellness Center because of the patient population. We have a lot of immigrants in Beaverton. Many of them come from war-ridden countries, and so it's different in the way in which we need to serve them than in the way in which we need to serve many of our patients in Newburgh. So really taking all of that into account, again, patient center, a place where they can get a variety of services under one roof: primary care, dental, pharmacy, education, wellness, again, navigation, eligibility, and they can also have access to mental and behavioral health. We constantly, some of these innovative ways in which we've also adjusted our model is to include more resources for our patients. 98% of those we serve are living or come from households with low incomes, and so below the poverty line. And so as part of that, we understand that our patients many times have to make tough choices between, do I put food on my table, or do I pay the rent, or do I pay my medication? So part of what we do at the foundation is to raise and leverage resources to better serve them and be able to support them with access to, again, the tools to be able to meet some of those basic needs. So during the pandemic, we established our Patient Support Flex Fund, which allows us to support our patients with food cards, with family-friendly food cards. We support them with paying for their electricity bills to keep their lights on, their heat on. So a lot of what we do reflects these pillars that you mentioned, because at the end of the day, we provide this whole person care that really looks at all aspects of our patients' well-being, not just what happens inside the exam rooms.
And I was just curious, so many of the people you serve are migrant farm workers, but not all of them. So what is your other population?
Yeah.
Is there like eligibility requirements? Is it how? can anyone just become a client of Virginia Garcia? How does that work?
Yeah. Well, Virginia Garcia, as a fairly qualified health center, we serve anybody and everybody, regardless of their ability to pay. If we have the capacity, and by capacity means we have appointments that to serve individuals, we will serve them. When I talk about eligibility, it's really to ensure that our patients who can qualify and don't know where to start and need navigation can apply for the Oregon Health Plan, for example, or benefits that they can qualify for, Medicare. And so that's what I mean by that. In terms of the makeup of our population, about 55% of our patients are Latinx, 55 and 60 are Latinx, about 30% are Caucasian. And we have just, again, a variety of other makeups. 10%, for example, is Asian, Pacific Islander, self-identified reported. We don't, we ask them to self-report that. And about 4% or so is Black or African American. And then we do have about 8 to 10% that don't disclose that. They don't self-report. In addition to the demographics, we also have about 50% of them are on the Oregon Health Plan. And you asked me something at the beginning that was very interesting. You said, can they not go anywhere else? So not every provider takes the Oregon Health Plan. So in a way, it is limited their access to who would allow them to use that insurance coverage. So about 60% of them are on the Oregon Health Plan. About, I would say 25% or so based on the latest data is on Medicare. About 30% are uninsured. So those are individuals who don't have any coverage and are paying for their services through us on their own. We do offer a scaling fee. We, again, don't turn anybody away for inability to pay. And we have about 8% that are also on 10% or so that are on commercial insurance. So individuals that at one point may not have had insurance were on the Oregon Health Plan, whatever that situation might be, were with Virginia Garcia. Now they have insurance, commercial insurance, and they like the services we provide and continue to come to see us.
So you can serve anyone in Newburgh who is looking for a primary health provider, you would serve them. If we have the capacity to see them, which is, we can. But so we don't turn anybody away. The challenge here is capacity, right? Sure. Which is why we're expanding the Newburgh Wellness, the Newburgh Clinic into our Newburgh Wellness Center to add capacity to be able to serve more members of this Newburgh and surrounding communities. Yeah, which is great to know, because I think some people have the perception, because of the focus on seasonal migrant farm workers, that, they will only serve them. And I know you said they don't, but I think it's good to clarify that. For example, I volunteer at Love Inc. here in town, and we often refer people, I should work there. I volunteer, a couple times a month, but we often refer people to you because people they don't have insurance, but they have a need. Then you guys are, and I've always wondered, what is the dynamic of how that all works? So it's cool for me to hear this as well, to learn more about how you work. And I wanted to get to the thing I've mentioned a few times with the culturally relevant, culturally appropriate, how that affects how healthcare is done compared to what they might get at one of the more big name, well known health providers. Yeah, and I'll add that in a 2-part. I'll answer that in 2 parts, I should say. Our strong emphasis on culturally specific means that when
somebody comes through our doors, we take their whole self into consideration, right? Their background, the way in which they would prefer to receive care, including language. So we provide interpretation, language care in their language of choice through interpretation, either in person or virtual. And it also means that we consider that when we deliver that care. Very different, for example, talking to a diabetic person that is Latinx versus somebody who might be, a Somali patient. So we really think about what will resonate and how to really incorporate all aspects of their well-being into the recommendations on how to manage that care and how to improve their overall well-being. It also means that we have staff that represent where they can see themselves represented, right? A diversity in the staff population that we hire, and ensure that we represent those that we're serving. Traditionally, culturally specific for us also means that we do have a strong emphasis and focus on populations, communities of color that have traditionally been underserved with healthcare services. So as part of that, we have a strong emphasis on serving diverse individuals. And also means that when we think about the future of our organization, I mentioned the innovative workforce development programs, that we're also considering how the future generations of service providers is going to reflect those populations as well. So, it's hiring diverse staff, providing care in the language that will be relevant and appropriate for the patient, the person in front of us, and that we're taking all those aspects into consideration.
One thing that maybe we can touch on if you feel like it's appropriate, but I know one of the hot button topics is vaccines and vaccinations, and some cultures feel much less comfortable than others. And I know some healthcare providers pride themselves in trying to pressure, and they probably wouldn't use the word pressure, but really making sure everyone gets vaccinated because they believe for the greater good that's important. And obviously there's a lot of people who feel strongly one way or another. Is that part of the consideration as well? Is kind of a I don't know what the word is, but kind of a acknowledgement that some people may feel uncomfortable, or is that, how does that work? Or is it more like, okay, no, we'd rather educate people and say, no, there are good benefits?
Yeah.
Does that make sense?
I mean, it does. And I think it comes, so the culturally specific for us, having been in this community for nearly 49 years, as we enter this 2024, it means that, yes, we're going to, inside and outside the exam rooms, we're going to advocate for, I would say, aspects of care that they may be hesitant about, that it's going to make a difference for them, right? For example, during the pandemic, we were seeing just a disproportionate amount of Latinx individuals dying and also getting COVID. Part of that really created, a lot of focus statewide and nationally to drive education and outreach for those communities of color. And so, yes, as part of our culturally specific efforts, we not only ourselves became better advocates and educators on that, but we also sought out to be more influential among other communities. So we know that we're trusted in our community. We also know there's other organizations that are trusted in their community. So we partner with them and said, hey, what would be meaningful? Could you reach out to the Asian Pacific Islander population? We will be we'll deliver the vaccine, but we need you as a trusted partner in that community to share why it's important for them to get it, right? And so that cultural specificity sometimes comes from us acknowledging and understanding that we are not the right partner at the table, but we are able to engage and collaborate with somebody who is. It also has led to some partnerships with public health organizations and agencies to better serve populations. Right now, we have an initiative as well with one of our counties to vaccinate individuals 55 and older, right? Ensuring that they have some vaccines that will improve their overall health. And so those are things, again, innovation, continuing that commitment to patient-centered that keeps us moving forward in ensuring that we are establishing the collaborations that are going to lead to more success and better outcomes for our patients.
Yeah. And it sounds like much more of the kind of education, like if there's an uncertainty, educating on, helping them, not get rid of, maybe it's the right word, but if there's misconceptions about the dangers or safeties of things, kind of utilizing that trust to say, hey, here's what research has shown, that kind of thing. And
that's why I think it's important when we talk about, when you said what it looks like, I said it looks like education, navigation, and eligibility under that roof. Because if somebody's hesitant and the provider says, this person should really get their shingles vaccine, and there's hesitation, we can have a community health worker talk to them about the benefits and the risks, right? And then let that individual make a more educated decision for themselves. And so we're able to do that right there and then because we have all these integrated tools on site. Yeah. You mentioned the expansion project that's happening in Newburgh. Can you share a bit about that? Yeah, it's a very exciting project. We broke ground in October and it's expected to be completed in early 2025. Currently, I mentioned the Newburgh Medical and Dental Clinics opened in 2014 in two separate suites, same building, but separated by two other suites. And so the two suites are less than 9,000 square feet. Oh, it's the same. Sorry. My language got confused there. 9,000 square feet. And this expansion is going to allow us to build out and have a clinic, a wellness center that is going to be nearly 2,200 square feet. 22,000. 22,000. Okay. Yes. I should read my numbers. It helps me with my Spanish versus English. Yeah. 22,000. What is the Spanish for that? I'm just curious. So that'd be, because I only know a little Spanish. Oh, so 22,000. Oh, so 22,000. How do you say 100 then? I'm just curious. We don't have 100. That's why I get confused. Yes. Interesting. It's only mil. Okay. Thousands. Yeah. Okay. So anyway, so 22,000 versus 9,000. That's exactly more than double. Yeah. And so in addition to this, this expansion is going to allow us to double the number of patients that we see there. So from about 6,000 patients, 300, end of day, 3,000 patients annually between our current medical and dental suite to about 6,000 by the end of the third year in operation. So about double the patient population by almost doubling the space. We're going from 6 exam rooms to 15, and 2 of them are going to be pressure negative ones. So next time, if there's a pandemic or someone has COVID, we don't have to wait between patients. And we are expanding dental operations from 3 operatories to 9 operatories. And it's exciting as well because this is going to provide us with our first bariatric operatory, meaning that across all of our sites, our clinics, this is going to be the first one that's going to allow us to better serve someone who is in a wheelchair or would be better accommodated by this setup. Yeah. Mm-hmm. That's exciting. Very. And we were talking a little bit before about the groundbreaking and how it took some time with permits, but
Where are you at right now? You mentioned it's going to be operational in 2025, right?
Well, it's actually open right now.
Oh, okay.
So part of our goal when we launched this expansion was to not create a bigger gap where there already exists one. So the plan has been very thoughtful in building out in phases so that we continue to provide care while construction is happening. It is a construction zone. There's still noise. You know, you hear those drills, and it's probably a little bit of dust here. But we really wanted to stay open for our patients. And so phase 1 is currently under construction, and it's expected to be completed this summer. Then we go into phase 2, and then there's a final phase. So right now we're building out the back of the building, that expansion, and then what's going to be our new lobby. And after that, we're going to take care of what's currently open and remodel that, and then go to the other side, remodel that. So, it's a really thoughtful approach. It's a nearly $20 million expansion. And part of that was additional costs related to this staying open this whole year plus, but that was non-negotiable for us. We can't really stop serving our patients who rely on us.
Yeah. Well, that's exciting to be able to do that, because that, one, is a very big expense. Where did the funding come from for that?
Yeah. So part of that came from fundraising. Our foundation, which exists for the purpose of supporting the health center, 100% of what we raise goes to the health center. We embarked in a capital campaign in 2000. My goodness, my years are now a little 2022. Okay. And continue through 2023. And to date, we are opening or continuing construction and expect to open this site free of debt. Part of the funding also came from about $3.2 million came from federal grants, a congressional request, and federal grants as well. So that total about 3.2. And part of it was a commitment from our board of directors to dedicate revenues from our operations from last year to this construction, because we know it's going to be big impact for this community and allow us to better serve Newburgh and other adjacent.
Yeah, that's incredible. Mm-hmm. So is the fundraising done, or are you still looking for people to support?
Yeah, well, as a fundraiser, I am never going to say no. So if anybody's very interested in contributing to this project, we, of course, would love, we're still doing a small campaign to raise dollars for sustainability features. This is going to be a green building. And so we have support to have solar panels, but there's other features we want to add as well. So also climate resilient. So if anybody's interested in supporting this project, we welcome any financial contributions, but also if you have a fundraising night you want to do at your business or any other endeavor, we love to talk to you and see if anything could be possible. There's lots of ways to engage with us.
Yeah. And I'm sure they can reach out to on the website. There's opportunities for people to reach out. Yeah.
So if you're interested, you can contact us. All of our information is on the website at virginiagarcia.org. And then soon our foundation is also launching our own website to help us better share this story and impact, and also connect supporters, volunteers to our work. So we're launching that site soon as well, but it'll be connected to the virginiagarcia.org site. So contact us if you want to learn more about our work, if you want to see our work in action and visit a clinic, we can do that as well, or just to learn more about this Newburgh Wellness Center. And we also have social media channels. We are on Facebook, Instagram, and LinkedIn, and you can contact us through any of those channels as well if you look up Virginia Garcia Memorial Foundation. We also as I mentioned, we have volunteer opportunities that you can find on our website. And if you have any other curiosities or have any innovative ideas on how we might be able to partner, you can contact us as well.
Well, I've got one last question for you that I didn't prepare you with, but I'd like to ask everyone who comes on the show is, given your position in the community and with Virginia Garcia, what gives you hope for the future of Newburgh?
In general, I have to say, the new generation gives me a lot of hope. I see a lot of involvement, a lot of interest in supporting one another, in giving to causes that really support community members, engaging at different levels, advocacy, volunteering, giving their time, their money, in their voice. So, I say this a lot, but in every aspect of not just Newburgh, I think in our world, the new generation really gives me a lot of hope.
Well, thank you, Stefanny, so much for coming on the show today. And I appreciate your perspective. I appreciate everything Virginia Garcia does as a foundation and health center. It's a very important part of our community. So thank you so much for sharing today.
Thank you so much, Daniel. Appreciate the opportunity to share more. And again, if you're curious, visit us at www.virginiagarcia.org. You can learn more there about our work, ways to engage with us, whether it's volunteering, donating, or coming to see one of our clinics.
Awesome.
Thank you again.
Thank you so much. Thank you for tuning in to the Giving Town podcast. If you enjoyed this episode, please consider sharing it with a friend who you think might benefit from hearing it. While more and more people are continuing to hear about this podcast, I still need your help to spread the message about all the people and organizations that make Newburgh so great. Well, thanks for tuning in, and I'll catch you in the next episode.